is Health 54 right here on your digital first Pan-African News Network TOS television. I am Rose Audu. Nigeria on Thursday recorded 182 new cases of coronavirus across 14 states and the Federal Capital Territory. The Nigeria Center for Disease Control (NCDC) published the update on its official website on Friday. The breakdown of the newly confirmed cases showed that Taraba State topped the chart with 38 cases for 27th of October 2021, followed by Lagos State with 27 cases, while Zamfara State recorded 25 cases. And the World Health Organization said on Thursday that it needed $23.4 billion over the next 12 months for its plan to conquer COVID-19, urging the G20 to show some leadership and pay up. WHO Chief Tedros Ghebreyesus bluntly told the group of 20 global powers meeting this weekend in Rome they could no longer leave poorer countries hanging out to dry in the pandemic. And the Minister for State for Health, Dr. Olorunimbe Mamora, on Wednesday disclosed that the federal government plans to begin the implementation of the new hazard allowance for medical and health workers in 2022. The Nigerian Medical Association and the Joint Health Workers Union have constantly been engaged in industrial actions over the increment of hazard allowances, which the federal government have pegged at 5,000 naira. A health watchdog has scrapped a previous recommendation of graded exercise therapy for ME. The National Institute of Health and Care Excellence has published a long-awaited and contentious final update to guidance on treatment. Many patients with ME or chronic fatigue syndrome said the therapy, which encourages patients to slowly increase their levels of activity, makes their condition worse. And the Medicines and Healthcare Products Regulatory Agency is inviting manufacturers to submit goods for approval to be prescribed. It could mean England becomes the first country in the world to prescribe e-cigarettes as a medical product. There have been much debate over the years about whether e-cigarettes should be used for this purpose. E-cigarettes are not completely risk-free, but they carry a small fraction of the risk of cigarettes. This is TOS Television, your digital first Pan-African News Network, and you're watching Health 54. Do stay tuned. Welcome back. The European Union has donated £400,000, consecutively 192 million naira to combat cholera in Yobe State. The EU lamented that the current outbreak has spread over the border with Niger, and additional challenges the health system is also under pressure due to the current malaria season, with the intense rain season increasing the risk of flooding and malnutrition. Africa's struggle to inoculate people against COVID-19 risk being hampered by a shortage of syringes. Just as supplies of vaccines flowed into the continent, the World Health Organization said on Thursday. UNICEF, the United Nations Fund for Children, is predicting an imminent shortfall of up to 2.2 billion of the single-use syringes used to give vaccines. And the United Nations Children's Fund representatives in Nigeria, Peter Hawkins, has restated its commitment to helping to curb maternal and child mortality in Kwame local government area of Gombe State. According to Hawkins, while UNICEF's intervention has already helped reduce pregnancy-induced death of mothers in Kwame local government, the fund will continue to assist stakeholders in the local government to improve maternal and child care. The nation island of Tonga has reported its first case of coronavirus infection since the beginning of the pandemic after a passenger traveling from New Zealand tested positive. In a radio address on Friday, Tonga's Prime Minister Pohiva confirmed that there was one COVID-19 case among 215. And the World Health Organization has disclosed that 1 in every 3 Nigerians die from a form of non-communicable diseases. WHO Nigeria Country Representative Walter Kusadi made the disclosure on Tuesday, October 26, 2021, in his goodwill message at the opening ceremony of the International Cancer Week in Abuja. The fact Nigeria gathered that the average Nigerian does not go for routine medical checkup, hence making early detection of NCDCs impossible. This is in turn lead to death, which would have been avoided. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.TOSTVNetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.